friends, welcome to my YouTube channel Apical. Today is our topic PR और HR. PR और HR क्या है? PR means pulse rate और HR means heart rate. PR or HR is the rhythmic dilation of an artery that results from beating of the heart or alternative fall and rise of artery due to left ventricle contraction is known as pulse. Then study of pulse is known as spimograph. Spimograph क्या है? It is the pulse can be recorded in a graph with computerized instrument. Then discuss difference between PR और HR. PR और HR बीच में क्या फर्क है? Heart rate is the number of times your heart beats per minute, while pulse rate is the rate at which your arteries expand due to your heart beating. And pulse rate is also known as heart rate. Then discuss characteristics of the pulse. Before assessing the pulse, nurse must be familiar with the normal characteristics of a pulse, the rate, rhythm, volume and tension. Then discuss first rate. Normal pulse rate varies depending on age. For a healthy adult, the normal resting pulse ranges from 60 to 90 beats per minute. An abnormal rapid heart rate over 90 beats per minute is referred to be tachycardia. जब pulse rate हाई हो जाते हैं 90 beats per minute, इसको बोलते हैं tachycardia. Then an abnormal slow heart rate below 60 beats per minute is referred to be bradycardia. जब pulse rate slow हो जाते हैं 60 beats per minute, तो उसको बोलते हैं bradycardia. Then discuss rhythm. It refers to be regularity of beats. Normally the heartbeats are spaced at equal interval and they are said to be regular. When the interval varies between the beats is said to be irregular. Then discuss volume. It refers to be fullness of the artery. It is the force of blood felt at each beat. Then volume depends upon the amount of blood in the arteries. If the volume of blood is decreased as by hemorrhage, the pulse will be weak. Then discuss tension. It is the degree of compressibility. It's said to be high tension when the artery is difficult to compress. Then low tension when it is easy to compress. Then discuss purpose of taking pulse. First, to establish baseline date for subsequent evaluation, to check abnormalities in rate, rhythm and volume, to monitor any changes in health status of the patient, to check the peripheral circulation, then to determine number of heartbeat per minute, then to assess response of heart to cardiac medication, activity, blood volume and gas exchange. Then discuss methods of taking pulse. These are classified into two types. First, palpitation. Second, auscultation. Palpitation क्या है? It is a feeling or sensation that your heart is pounding or racing. Then second, auscultation. It is a common method for measuring a patient's heart rate and rhythm using a stethoscope. Then discuss factor affecting pulse rate. First, Sex. After puberty, the average male's pulse rate is slightly lower than female. Puberty के बाद pulse rate मेल के हिसाब से फीमेल का लो रहता है. Then exercise. PR increases with exercise. एक्सरसाइज करने के बाद पल्स रेट इंक्रीज हो जाता है. Then discuss fever. Increases pulse rate in response to the lowered blood pressure that results from peripheral vasodilation increased in metabolic rate. Then medication. Basically epinephrine increases pulse rate. Epinephrine यूज करने से पल्स रेट हाई हो जाता है. देन डिस्कस स्ट्रेस. इंक्रीजेस सिंपैथेटिक नर्व स्टिमुलेशन, increases the rate and force of heartbeat. Then position change. Decreases in the venous blood return to heart, decreases blood pressure and increases heart rate. Then emotion. Anger or excitement increases the pulse rate temporarily. Then discuss drugs. Stimulant drug increases the pulse rate and depressant drugs decreases the pulse rate. Then discuss variation in pulse rate by age. First discuss age, then pulse rate. First, neonate, just 28 days, pulse rate 100 to 205 beats per minute. Then infant 1 month to 1 year, pulse rate 100 to 109 beats per minute. Then toddler 1 to 2 years, pulse rate 98 to 140 beats per minute. Then preschool 3 to 5 years, pulse rate 80 to 120 beats per minute. Then school age 6 to 11 years, then pulse rate 75 to 118 beats per minute. Then adults 12 years and above, pulse rate 60 to 100 beats per minute. Then athletic means player, pulse rate 40 to 60 beats per minute. Then discuss site of monitoring pulse. There are 9 sites where pulse can be commonly taken. First, radial artery. Radial artery is located in front of the wrist. Then second, brachial artery. Brachial artery is located in above the elbow and in the antecubital fossa, means inner part of the elbow. Then third artery, carotid artery. Carotid artery is located at the side of the neck. Then fourth, temporal artery. Temporal artery is located over the temporal bone. Then fifth artery, apical artery. Apical artery is located above the apex of heart or left center of chest, just below the nipple. Then sixth artery, femoral artery. Femoral artery is located in the groin. Then seventh artery, popliteal artery. Popliteal artery is located in the popliteal fossa, means back of the knee. Then eighth artery, posterior tibial artery. Posterior tibial artery is located behind the medial malleus. Then ninth artery, dorsalis pedis artery. Dorsalis pedis artery is located on the foot. Then discuss pulse quality scale. Pulse quality scale basically measures 0 to +4. पल्स क्वालिटी स्केल में फर्स्ट आता है 0. 0 मीन्स पल्स नॉट पल्पेबल और absent. Then +1 means weak and thready, difficult to palpate. Then +2 means diminished. +1 and +2 on the scale that indicates low stroke volume like hemorrhagic shock. Then +3 means easy to palpate and full pulse. +3 on the scale that indicates normal. Then +4 means strong and bonding pulse. +4 on the scale that indicates anxiety and heart disease valvular condition. Then discuss how to take pulse rate. पल्स कैसे चेक कर सकते हैं? पल्स चेक करने के लिए क्या प्रोसीजर होता है? लेट्स डिस्कस. फर्स्ट, प्लेस टिप्स ऑफ 3 fingers other than thumb lightly over pulse side. Do not press the artery with more force. After getting the pulse regularity, count the pulse for 1 minute looking at the second hand on the wristwatch. Assess the rate, rhythm and volume of pulse and condition of blood vessels. If the pulse is regular, measure for 30 seconds and multiply by 2. If the pulse is irregular, count for 1 full minute. The radial pulse is usually the most accessible and can be taken most conveniently on an adult patient. Then the apical pulse is used to monitor if the radial pulse is inaccessible, listening through a stethoscope. Then the pulse check in an infant, palpate a brachial pulse, and in a child, palpate a carotid or femoral pulse. So, this was the pulse rate or heart rate. If you understood this video, then please like, share and subscribe my channel. If any doubt, please comment me, then I will clear all doubt. Thank you.